I want to talk about, first of all, I want to give a special thanks to Kevin Kerrigan and the Guam Regional Medical City, because every time we have medical questions, Kevin steps up to the plate. And GRMC has been fantastic about inviting the doctors over there to come and have a chat with to talk about some of the medical issues that we have here on our island and here in our community. So I wanted to special thanks to Kevin and GRMC for always being available, even at short notice. So in studio we have Dr. Jose Hernandez, who is a pediatrician. Half a day, Dr. Hernandez?
Half a day to you.
Dr. Hernandez has been here for only 4 months. So you're new to Tumon.
That's correct.
Did you enjoy your little Tumon visit?
I love it so far.
Okay, I don't think you're going to leave here, because some of the best eating is down here. You're going to want to look for a restaurant. We actually even have a restaurant up front. Maybe you could try it out. It's they sell Mexican food.
I'm Mexican, so I'm going to like it.
I hope you like it. I hope it meets your standards. But you might want to go up there and check it out. We do have fantastic eating in Tumon, so it's a good thing you've decided to come at dinner time. You've worked in many places, in many countries, and you're a pediatrician. I'm going to tell you the reason why I've asked you to come in. A statistic was shared with the media from Dr. Shimabukuro at GMH, and it was a little bit shocking to us that our under 5, or I'm assuming it's our under 5, but it's our pediatric mortality rate. I can't even find a definition for that online, technically what that means. I have 2 mortality rates, and that would be infant mortality rate and under 5.
Right.
But she gave a pediatric mortality rate of 14.5. I can't compare it to anything. I don't know, but apparently she says it's very high.
It is high.
Okay, so you worked in many countries, and obviously, regionally, people have different medical issues that they're dealing with. You've been here in Guam for only all of 4 months. Based on your initial assessment, what are some of the major issues in pediatrics that we have here? What are the biggest concerns that you have as soon as you stepped on island with our children?
Well, thank you, Andrea, first of all, for inviting me to come here and speak with you. I can tell you this, that just to kind of back up my background, I'm a hospitalist, so that means I work in the hospital setting. So that means I deal with mostly acute care, meaning that the kids that are sick at the time of visitation, right? So that's kind of what my specialty is. So in my experience, in most countries, from all my reading that I've done, the number 1 cause of mortality rate in all the countries is infections. Okay? Here in Guam, I've been here for 4 months, and that is actually true to Guam so far, in the sense of what we're seeing in the community. We're seeing a lot of patients they come in with lots of different infections. I can give you an example. We had a child, this was a 12-year-old, who fell off a motorcycle, and he burned himself, and a few weeks later he showed up to our emergency room with a condition called bacteremia from a really bad bacteria, MRSA, and he was very sick, right? And he had a bone infection that spread throughout his blood and caused major problems with him. He had to stay in the hospital for a long time. That's just one example. Now, when they say infant mortality and under 5 years child mortality, the reason they do those statistics is because that is a very critical age where children are prone to disease, right? But so again, number 1 is infection, and obviously we can break it down into different areas of infections. I can tell you that dehydration from gastrointestinal infections is very high in third world countries, and I believe that Guam, for me, just being here in 4 months, I would consider Guam, in the sense of healthcare, a third world country.
That's apparently we're finding that out. I mean, I don't think this is entirely news to us, but I think again why this came out was Dr. Shimabukuro's testimony at the public hearings, asking for money for the Guam Memorial Hospital. This is what happened. And part of her testimony, which was very emotional and moving, was that she didn't have access to a pediatric endoscope.
Yes.
At the hospital, and she said this is equipment that I've seen in third world countries that we didn't have locally. And you know, in all fairness, we have been trying to contact her to give her a chance to speak. But in lieu of that, we have again Dr. Hernandez here who can speak to some of that. Tell me why, in your estimation, based on your travels and what you've seen, that you would say medically Guam is third world. Because that's a very strong statement.
Yes. Well, resources, right? So obviously, if you don't have the resources to build the infrastructure and to bring in the specialists on board here in the territory, and also the technology, whether it be medicines or whether it be equipment, well then, you know, you're not working as a first world country. Where I came from the United States just recently, and I've worked in multiple hospitals where we have the state-of-the-art technology, the latest, right? For the most part, here in our hospital, GRMC, we do have that technology, and we're offering it, right? Now, so it's coming here now. It's available. Not everything, and but we're getting there, right? Slowly. So I think it has to do with resources, and that means that people that have vision, people in the government sector, people that are grassroots, they need to be involved and actually request for this technology, for the specialists to come, for medicines, for equipment. All this needs to make it here, enable for the children to have a better chance.
Right. Some of the issues we remember, and again, I don't think the government likes hearing this, but the truth is, just last year we had to borrow money, and it was quote unquote the hospital bailout. And the reason why it was so dire, and this was for Guam Memorial Hospital, is because if they didn't pay their vendors, we weren't going to have medicine available. And so I can hear and understand. I mean, it's terrible. I mean, I feel terrible that you're sitting here telling me that my island medically is operating in third world standards. But again, that has been the theme since Dr. Shimabukuro went into that hearing, and it's opening our eyes as a public, realizing down to the detail what we lack here. We know that we have medical fundraisers to send people off island all the time. We know that we have problems with our health care here on Guam. But when you say something like we don't have a piece of equipment here at Guam Memorial Hospital, or only public hospital, that people have in third world countries, it kind of opens our eyes to the degree of where we are as far as health care goes. So again, you're a hospitalist, meaning a lot of the children that you treat or you see are in that situation where we've got to take them to the hospital and there's something really wrong. It's not regular well baby checkups or anything like that. These are children who are actually sick. So MRSA, you said, I've heard that. That's common on the street? That's what they call MRSA, right?
Yes, correct.
Okay, and so I've actually heard that is also kind of a third world type infection. That's when kids don't get treated. You see it a lot when there's sanitation problems, that type of thing. Is that true?
Well, partly, but more than anything, it has to do with it's a resistant bacteria that has, because of maybe multiple antibiotic usage, and sometimes inappropriately usage of antibiotics. You know, bacteria are very smart, right? They're trying to protect themselves, and we're trying to obviously protect ourselves. So the bacteria is basically building a resistance to the antibiotics, and that's why it's called methicillin-resistant Staph aureus. That's the name of the right. So it's more than just hygiene. It's more, you know, the improper use of antibiotics in the long run, and not necessarily Guam. You know, it could be in a first world country. We have it in the United States. We have it in first world countries too. However, I think what's happening is some of the children here are delaying their care, and therefore by delaying their care, now they become sick and severely sick, to the point now they can actually suffer long life consequences from that. So one of the biggest issues that I'm again 4 months here in Guam is that I'm finding out is that part of the issue is education. Again, I don't know how these people, a lot of these people may not have insurance, so that's another resource that they may not have, and that's the reason they're not going to their doctor to take care of it right away, and so they're coming to us fairly sick already.
Well, here's an issue that I have, because I am also an advocate, a community advocate, and I advocate for patients who would like to opt for natural therapies, cannabis therapies, to implement into their health care. And in my research, if I want to pull up how many people have bipolar disorder in Japan, I simply Google it, and the information appears, and there's somebody has compiled a report. For Guam, it's nearly impossible unless you go somewhere and beg and try to find, and then somebody. I just don't know. In order for us to improve, we need to study, right?
Correct.
And if people out there are willing to look at the statistics and compile them and take a look at them, they're not able to do so because we simply can't pull them up. It's difficult to access.
Well, and that kind of goes along with, again, third world country resources, right? So if you try to, let's say, I've been to Africa multiple times, by the way. And so let's say, I've been to Lusaka, which is a city in Zambia in Africa, right? If you try to do a study over there, well, because the resources are not there, the people really don't follow through, it's very difficult to really put a number on things like that. And I think maybe Guam may be finding the similar issue as another country like that, like I'm describing right now. When you do a study, you have to actually, it takes time and it takes resources and cooperation from patients, doctors, researchers, scientists, in able to do this, right? And so if you don't have all those in place, well, it's very difficult to come up with numbers. You can't just pull them from the air.
Well, I've had to try to do work with the Department of Public Health and Social Services myself. And I've not had to deal with any of their previous directors, but this particular director tends to be a little bit difficult to work with. He tends to want to cut off the public when the public, he calls the public opinion or public outcry or public concern noise. And so I can see that it can be difficult to interface the community and private resources with the government resources when you have people that don't necessarily want to work as with the community, and that you're kind of stunted because there are private resources out there. There are people with grant money, people, nonprofits here that may want to do further studies or get money to do studies, but it's got to be in cooperation with our government. And I see that sometimes it's difficult to work with our government.
I can understand what you're saying, and the reason I can tell you this is because, I come from, again, when I come from the United States and people over there, you can say the culture over there, we tend to be very promptly when we do things, where we show up on time, we try to accomplish projects on time, we have timelines, or, we need to be, and that's the beautiful thing about the United States. At the same time, people get burned up, people get exhausted from doing work like that. Now, coming here, Guam, it strikes me as going to my native country of Mexico, where people are laid back, so people are not on time a lot of times. Well, I'm going to give you an example, and not to put down the EPA, but I've called the EPA because I purchased a home here in Tamuning, and it's an older home. And just to try to ask one question, I get the runaround on the phone. It may take 10 minutes and I don't get an answer, right? And that means that there's obstacles involved. And I'm not labeling anybody because I don't know anybody there, but it just, you don't get answers.
Right.
And that's kind of what I'm saying. The obstacles, right? And so I think there's got to be something in the culture that needs to change. And I'm not here to change them, but I'm here to encourage them and to challenge them that they can do better.
I'm glad you are, because we're talking about the health of our children. Dr. Hernandez from the Guam Regional Medical City Pediatric Hospitalist is what your title is. I have two questions before we wrap up. One is you talked about MRSA. That's an example that you've seen. What are, if you could say, the top two issues that you see coming into the hospital for acute care? If you could just give me what are the top two, and what can we do to prevent from getting into that situation?
So I say that the top two since I've been here, it's been skin infections, and that's basically what it is kids will scrape themselves or they'll get a mosquito bite. Very simple thing. They scratch themselves and they actually inoculate or inject with their dirty nails, dirty fingers, or even their skin, the bacteria, right? And it doesn't matter which bacteria. There's bacteria on our skin. So that's one problem they're having. So one of the biggest issues we've had is that. And then number two is gastrointestinal infections. We've seen quite a few cases of Shigella. It's another bacteria that infects the gut. And that's because people don't wash hands well after going to the bathroom. So I'm going to say ways that you can prevent all these infections is by good hygiene, whether it be, after kids get a scrape on their skin, they need to wash up with soap and water, or before eating, they need to wash their hands. That is actually the number one thing to do to prevent infections, good hygiene.
As far as pediatric mortality is concerned, and I agree with you. I mean, I think growing up, we all had some kind of strange. Those were the two issues. You had stomach issues and you had skin issues. I mean, even for myself growing up. But as far as pediatric mortality, what are you seeing again? The top two things that you're seeing. Just obviously, you've only been here for a limited time. But what are some of the preventable things that we could do so that we don't bring our children into those dire situations?
I would say that the best thing that people can do is, especially pregnant moms, when moms get pregnant, they need to go get care. At GRMC, we're getting a large amount of moms that are pregnant that come in labor 9 months later to deliver their babies, and they have no prenatal care. I say that would be a good start to start there. That they need to go seek a doctor while they're pregnant, so they can actually get educated and they can actually get tested for different diseases. For example, hepatitis, HIV, group E strep is another bacteria that can cause severe problems in a baby. Right? Those are simple tests that can be done at the doctor's office.
Do you have? And my last question: are you seeing I would say increase, but obviously you've only been here for 4 months. Are you seeing pregnant mothers coming in with drug issues?
We have, no different than the United States. We've had some cases there as well that test positive for different drugs. So that needs to be addressed as well. Why? Because it actually affects the fetus, right? So if the mom takes the drug and they're pregnant, well, the fetus gets affected depending on what time of what stage of the pregnancy they're taking it. Then it affects the baby in different ways.
Dr. Hernandez, I want to thank you again so much for taking the time to come down to the studio. I do hope you have a good dinner down here in Tumon, and I would like to invite you back. I'm only here through next week, so we can have a real more in-depth conversation. I would really love to do that. And when it comes to our kids, that's one of the most important things in our community. I think that's one thing you can agree with us. But it's time for us to sign out here on the Afternoon Brew. We are News Talk K57. It's been wonderful. I will see you on Friday, Liberation Day.